Bom dia, boa tarde, boa noite, or whatever the case may be. My name is Marcus, and I am the host of the Black Brazil Today YouTube channel, as well as the blackbraziltoday.com blog, where I analyze Brazil from the perspective of race. So, the topic of tonight's video is, well, it was influenced by a video I saw maybe, I don't know, a couple of months back. I think this video might have came out sometime in March or April, if I'm not mistaken, but it was a young blonde nurse who was talking about how she treats her black patients differently. She works in, I guess a hospital setting where she helps women who are going to give birth to children, their children are being born at that moment. And she said some pretty intriguing things. She talked about how a lot of black women's concerns are not addressed during treatments and guidance from doctors when they're pregnant. She spoke on how sometimes, maybe black women may have fear, of how they're going to be treated when they come into a medical establishment. And this is not something that should be taken lightly because, African Americans have a long history of, being treated, how can we say, like inhumanely, under physicians' care. I can't remember the lady's name, but there was a book some years ago where this lady was talking about this, like, I think it was called like medical apartheid. And she just talked about the history of, how black people have been treated in the American medical establishment, experiments that have been done on black men and black women. A lot of us know about like the Tuskegee experiment, but there's a long history of African Americans just being treated as less than human. And so when this young nurse spoke about, as far as she knew, this didn't happen in any other, I guess she said like advanced countries, or we could say first world countries. Like, why is this happening in the United States and nowhere else? Well, I wanted to address that a little bit because, Brazil is not really considered a first world country, but it's not a third world country. Some sociologists would say, people who are into political science, they have labeled Brazil as somewhat as a second world country. It's not quite first world country, but it's moved up from third world status. And when I saw this young woman's video, I said, I know I have to do a reaction to this, not necessarily a reaction, but just to share the fact that, no, this is not something that just happens in the United States. This article that I'm going to, revisit is actually from November of 2012. This was like within, around 1 year that I had been doing this blog already. And there's numerous other stories that I have on the blog that talk about how black Brazilian women are treated in the Brazilian medical system. So no, it's not something that just happens in the United States. Before I go any further, let me just play a small clip of what this woman said. I think her name is Jen something. I think the video was originally released on TikTok, and then it just went viral. It went up on, people reacted to it on YouTube. I saw it on Facebook. I'm quite sure it was shared on Instagram. So I'm quite sure probably millions of eyes have seen this video by now. But just as reference to what I'm talking about today, let's take just a quick look at some of the things that this young lady said.
I'm well aware that what I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, "I'm colorblind, I don't treat my patients any differently," meaning that they don't treat their black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James Marion Sims. So not only Are Black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my Black patients differently. Number one, I don't expect them to inherently trust me because I'm wearing scrubs and a badge, and I don't get offended if they don't. Many Black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really, really drive it home that I promise you that I'm going to believe everything that you say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer. And I'm not going to let anyone do anything to them, only for them and their baby with their permission.
Okay, so a lot of what she said can be applied to when I discovered this situation that was going on in Brazil. As I've said, in doing some of the material that I do, I often find that anything that African Americans have a concern about in the United States, often I can search, keywords in Portuguese and find the exact same thing going on in Brazil. So this is something that I've been talking about, obviously, for some years. So today, I saw that young nurse's video again today, and I says, okay, well, let me, talk about how this situation plays out in Brazil because it's very similar. Um, and this is not the only article that I've done. There's a number of articles that you can find on blackbraziltoday.com where it's talking about, this kind of medical racism, how Black people, some of those articles speak specifically on Black women during the time that they're pregnant. And other articles are just speaking about the overall treatment of just Afro-Brazilians in the medical system in Brazil. Okay. So some of the articles that I have that I've published before, let's just take a look at a couple of the titles. This one is from 2021, and it says, "Today it won't hurt too much. Don't worry. The day I was seen by a Black gynecologist for the first time." So this is a very revealing, article. And it kind of followed up on something that a lot of us have believed for a long time. Some of the things that we complain about that, the system will just blatantly deny that there's any type of racial bias involved. A lot of us feel like until we have people who look like us in these positions having a certain authority, maybe if we have more people who look like us in these positions, maybe, some of these things won't happen as much. So this is something, this was something I'm gonna have to. I know I say this all the time, but again, I'll point out there's like 3,700 articles on the blackbraziltoday.com blog. So there's plenty of material to go through here. So this woman is talking about, the first time she saw a Black gynecologist. Now understand that there's still a very small minority of Black doctors in Brazil's medical system. So, this is probably an experience that a lot of Black Brazilian women have, how they've been treated by, white doctors, instead of people just blowing it away like, oh, you're just whining. That's not true. Just like, the young woman, the young American, the blonde woman said, hey, pay attention to what these women are saying. Why should they be ignored? Here's another article it's from earlier in that year, January of 2012, says Brazil, bias in medical treatment of Blacks. Of deaths reported in childbirth, 80% of the women are Black. Now, of course, let me, just make it clear that when we say Black here, we're talking about a mixture of the Black and brown population, what they call pretas and pardas. So Black and brown women. I've already addressed that issue several times. It just, like I said, when you look at the term parda, it just depends on what we're talking about here. There are a lot of pardas or mixed or brown people who are of African ancestry and visible African ancestry, and there are others who simply aren't. But, statistically, they still merge those two statistics together, Black and brown. This is also from 2012, the fight for public health through the fight against racism in the medical industry. Brazilian government wants to combat racism in health services rendered to Afro-Brazilians through its national healthcare system. Okay. Afro-Brazilians suffer institutionalized discrimination in health services, says the director of an NGO. So this isn't a new topic. This is something that's been kicked around for a number of years. When I first started studying about Brazil, there were just numerous articles coming out where whatever area of society that they were looking at, they were finding these discrepancies between the black and the white population. Let me see, what else do we have here? Okay, so actually, the article that I'm gonna revisit today, this is something else that you can find widely on YouTube. If you can read Portuguese, you'll come across some of these articles. Like what does this one say? Let me see. I think that's sickle cell. It says the myth of black women resistant to pain makes it difficult to treat sickle cell anemia. It says in the maternities, pain also has color. Let me see. Racism in health, the color of pain. Let's see. Black women suffer from violence from their obstetricians. When they are going in again, when they need guidance and care when they're pregnant. Let me see what this full article says here. Yes, it's asking, why do black women have more risk of suffering this type of treatment? When does it one say? When color determines what I guess your medical attention. Maternal death is more frequent among black women. Black women, says specialist. The myth that the black woman is stronger or more resistant to pain. This is something that you hear from activists coming out of Brazil for, it's been years people have talked about this. So this isn't anything that's new. I just, like I said, because of the video that I saw, I felt like I wanted to do kind of a reaction to this, to talk about, well, no, this is not something that just goes on in the United States. This is Eliane Barbosa da Conceição. She's featured in the article that I'm going to talk about today. She talked a lot about how black women are treated when they go for medical attention, as has a well-known activist and doctor, Jurema Wernicke. She's talked a lot about that. If you just Google her name, you'll find all types of articles, or interviews where she's talked about this. Says racism makes black people sicker. Basically, what she's saying there. So again, these are just some of the. This is a more recent article. I might cover this one day, but I'm saying it just it speaks to just more evidence of what I'm talking about. Black women are more neglected during childbirth. What this article is saying here. So I'm going to get back into the original article that I'm going to cover today, and just keep this in mind that, like I said, I'm doing this because of the video that I saw from the American woman who spoke on the differences between how black women are perceived when they need medical attention during childbirth. So let's get into this article. Again, this is from 2012. This is almost 11 years ago. Let's check out what it's talking about here. Again, this is Eliane Barbosa da Conceição. So the article, I'm glad I saved this article and it's on the blog because, I went to look for it today in its original source, and neither one of the links that I have posted, giving credit for this article, neither one of them are posted anymore. They get error messages. So I'm glad that this, I have this piece saved, on the blog, for obviously the Portuguese versions are no longer available. So it says, if a black woman and a white woman both need emergency obstetric care, the Brazilian physician will choose the white woman because of the idea that black women are more resistant to pain and are accustomed to giving birth. Brazilian social and cultural conventions attribute to blacks conditions of stereotypes that cause them to not get the same degree of health treatment as whites, said psychologist Chris Fani Souza Soares of I'll just read the translated name of this organization, the National Network of Social Control and Health of the Black Population. These stereotypes reflect a racism that is harmful to health and that a campaign is trying to eradicate from the Brazilian hospital system. Okay, keep in mind this article is from 2012. So it says of the 192 million Brazilians, I think Brazil's population is over 210 million by now. This article, again, this is from about almost 11 years ago. Say out of the 192 million Brazilians, half recognize themselves as Black. Again, let me reiterate that when they say Black here, they're considering the Black and brown population. The pro-health national mobilization of the Black population was launched this year by Afro-Brazilian organizations with support from the United Nations Population Fund. Under the motto, Vida longa com saúde e sem racismo, long, healthy life and without racism. The aim of the campaign is full health at all stages of life, encouraging the society and in particular the health system to combat discrimination to reduce the high rates of mortality of the population of African origin. Virtually all of the health indexes or indices of Black women are worse than those of white women. In a consultation about breast cancer, Black women are less thoroughly examined than white women and receive less anesthesia in childbirth, says Chris Fanny. The Ministry of Health, that since 2006 has driven a comprehensive national policy for this population group in the context of SUS, which is Brazil's national healthcare system, is the unified health system, conducts studies to detect this type of situation. The idea that the Black population is more resistant to pain and better able to cope with disease is present throughout the health system. From the nursing staff to the doctor, said Deise Queiroz, the coordinator of the Articulation of Black Youth in Bahia. She knows this well, especially because her mother, who suffers from diabetes and high blood pressure, often must resort to the public health system. According to the activist SUS, again, Brazil's national healthcare system, which was a model of democratization of health services, today so cannot meet demand and racist attitudes become more evident. The researcher Eliane Barbosa da Conceição of the Fundação Getúlio Vargas remembers a study done with doctors about the basic care of Black women during childbirth. This is Eliane talking. The responses that the doctors had when asked about basic care given to Black women during childbirth were that Black women, were stronger, they had thicker blood, that we Blacks have stronger teeth, that we Black women are more resistant than white women. So it wasn't a logic given by them, the doctors, but it is the logic of the research. The Constitution states that health is a universal right, and the state has a duty to provide this. SUS, again, the national healthcare system in Brazil, provides that all persons are entitled to humane treatment and quality without any discrimination. However, racism infiltrates openly or subtly. It incorporates itself in the living conditions of the population, the organization of health services, and policy formation or policy formulation, said the UNFPA representative in Brazil, Fernanda Lopes. Because of this, it's necessary to build specific policies of equity, she said. An epidemiological study of the Ministry of Health provides specific information to help fill in these gaps by comparing indicators such as prenatal care by race, color, and ethnicity. It also examines other aspects such as the right and access to family planning, which is among the most precarious amongst African descendants. It is precisely this aspect that is the center of the UNFPA Globe Report, submitted on November 14th with the title, By Choice, Not by Chance, Family Planning, Human Rights, and Development. For example, 19% of children born alive to teenage mothers are white between the ages of 15 and 19 years of age. However, the incidence of teenage pregnancy is 29% among young Afro-Brazilian women in the same age group. Furthermore, while 62% of mothers of white children say they have made 7 or more prenatal consultations, only 37% of newborn children of mixed mulattoes or Black women had the same number of consultations before delivery. This is just a picture of some children from Minas Gerais, again in southeast Brazil, the state, Minas Gerais. Infant mortality also shows disparities. The risk of Black or mulatto children dying before the age of 5 by infectious and parasitic diseases is 60% higher in relation to a white child, and death from malnutrition is 90% higher. The study also found that more pregnant African descendant mothers die than white pregnant women from causes related to pregnancy, such as hypertension. They say that the worst health indexes of the Black population are due to the fact that most are poor and therefore more vulnerable, noted Chris Fanny. However, one cannot deny other strictly racist variables, she warned. If a hospital sees two young people who have been shot, it is easier in the cultural imagination to put the white in the role of the victim, while the Black would be there because he was involved in a crime, assessed the psychologist, affirming that sometimes this reference causes a professional to establish priorities in treatment. Another concern relates to diseases prevalent in people of African descent, such as sickle cell anemia, diabetes mellitus type 2, and hypertension, that the health system is not prepared to address in a specific way. Black women are 50% more likely to develop this type of diabetes, with the aggravation of hypertension among them being 2 times higher than in the general population. The same occurs with sickle cell anemia, which could be detected in newborns. According to Pro Health National Mobilization, about 3,500 Brazilian children are born each year with this disease, making it the highest incidence of genetic disease in the country. The Black population dies in general sooner, and their deaths from preventable causes are more frequent, Fernanda pointed out. Therefore, a policy to combat discrimination in health should minimize the impact of historical inequities through strategies of affirmative action, she added. UNFPA FPA contributes with the government and the Movimento Negro, the collection of Black civil rights organizations and movement, to strengthen the policy and training that should accompany it. The challenge is to answer why, in a country where the Black population represents 50.3% of the total, we have a picture of health so differentiated between Blacks and whites, the Ministry of Health admitted. So, again, the original articles that I used for these came from the Envolve Verde website and the TVT. There was a closely related video on both of these on this site and then this article here, but neither one of them are coming up anymore. So again, I'm glad I'm able to save some of this material, when the original articles are no longer available. So this article speaks volumes. On a more personal note, I can kind of understand some of the stuff that's being talked about here. During the years I was living in Sao Paulo, when my then girlfriend got pregnant, and we were going for her examinations, I distinctly remember one time, we were using SUS at the time. Later on, we went and got a private healthcare plan. But I do remember her, we had went to a doctor. And when we left out of the consultation, I remember her saying to me, Mark, did you notice that, I could notice she was a little bit aggravated with the consultation. And when we came out of that consultation, she said, did you notice the doctor he was writing something on his paper and taking notes from what she was telling them. He took her, blood pressure or whatever, and all the things that doctors do, checked her oxygen or whatever. But all the while he was talking to us, specifically her, we were sitting at that desk. He never lifted his head up once from what he was writing. She noticed that. She says, did you notice he didn't look up at me at not one time while he was interviewing me and asking those questions? And so there was a distinct difference. While we were using the SUS public health system, I mean, it was adequate. There were times where we did have to wait, long periods of time. But when we switched over to a private medical system or healthcare plan, there was a noticeable difference in the healthcare. Obviously, if you've ever gone to a public hospital versus a private hospital, is the differences are quite evident, right? So there's been a number of Afro-Brazilian women who have spoken about how they felt they were treated during their time, during their pregnancy. So this is, looking back at what the young woman said about the American situation, it replicates itself in Brazil. Brazil, United States is not the only place where this happens. As I've said before, there's so many specific topics that I could create a whole video channel about. This is another area of how Afro-Brazilians feel, how they're treated in the medical system in Brazil. I'm going to do more to follow up with this particular video, because there's a lot of material that I could cover about this, but I just wanted to, share this information with my followers, because we should know that when we look around the world, when we look at specifically the Americas, uh, in Latin America, these studies on race were lagging for many years. But, with the rise of Black identity politics throughout South America and the Caribbean, similar studies are being done in Peru and Ecuador, Venezuela, Colombia, because they have Black populations as well. I think this research is a little bit more in depth what's going on in Brazil because the racial politics have come a long way in the last 20 years. So anyway, I'm going to leave this video here. Definitely feel free to drop a comment on this video, share this video, like this video. If you got something out of this video and you look forward to another one, definitely click on the notification bell so you'll get my videos as soon as they go up. And with that said, I'm going to end this video here and invite you all to come back and check out the next video.